Why would gastric stimulation do anything? Well, it turns out that the GI tract makes a huge number of hormones and also has connections to the nervous system. So, for example, when you put food into the stomach and the stomach dilates, you send nerve signals via the vagus nerve and via the superior cervical ganglion back to the hindbrain, to an area called the nucleus solitarius. And that then controls things like satiety, some of the vegetative functions, and it sends signals to the hypothalamus, where it helps to control some of the metabolic regulations like glucose and fatty acid metabolism. So there is the notion that if you can now stimulate the stomach with an electrical stimulus, you can activate this normal physiologic pathway and make it work better, and now take advantage and have these signals now allow the brain to control both food intake and your glucose metabolism. Now, what does the TANTALUS do? You laparoscopically implant the electrodes into the fundus and into the antrum. Okay? It's an outpatient setting and it's fully reversible. What this device does, when you eat, it is activated and then it sends the signals to the antrum, which then sends the signal to the brain. Well, that's the way the body works normally. You regulate postprandial glucose, okay, by when you eat. Now, this device can detect up to 7 meals a day and with 80 to 90% accuracy. One of the beauties of this device is it now removes compliance from the problem. When the patient eats, the device is activated. When you then activate it, you then cause an increase in satiety, which reduces your food intake, okay? And what it does, it affects glucose metabolism, as we'll show you later. Now here, when you take a meal in, the meal then causes the stimuli to go to the brain, but there's a great delay in that. With the device, because it's turned on immediately as soon as you detect the meal, you get rid of the delay, and therefore you have an immediate effect on the brain, and that's going to help cut down food intake even better. The other key difference here is how the electric signal is given. Ordinarily, we think about giving electric signals to pace. When you have a cardiac pacemaker, you provide the signal and it increases the rhythm. Now, in the TANTALUS, it was found that if you actually stimulate with the electric current during the refractory period, after the normal impulse has gone, all right, you won't change the rate. What it does do, however, it changes the currents and increases intracellular function such that you greatly increase the force of contraction of the antrum. Notice that you get a 2 to 4-fold greater contraction. That then leads to greater signaling to the nervous system, so that you will get then a greater nervous system response. So, the principle is the automatic food detection is a key component of this. And you can see that this is exactly the cascade that we've talked about. The TANTALUS can potentially provide a new, novel way of stimulating the stomach, which allows us to activate the brain and now be able to reduce food intake and improve glucose metabolism in our diabetic patients. This does not cause any nausea, any vomiting. There are no GI side effects afterwards. We now have a treatment for the patient with diabetes, implanted once, and for 5 years or longer, you have this automatic system.